Best Practice Guidelines for Facial Nerve Monitoring. I'm Jack Kartush. Part 1, Pre-Incision Checklist. Facial nerve monitoring has proven itself to be a very effective adjunct to reduce the risk of iatrogenic facial nerve injury. However, on the rare occasion when it fails, we need to look for a source, either the device or the user. Just as pilots unfailingly use pre-flight checklists, we need to do the same for facial nerve monitoring in order to optimize care. Therefore, we published best practice guidelines for facial monitoring with a checklist that can be used. Divide best practices into 3 headings: pre-incision, post-incision, and ongoing. For today's video, part 1, we'll focus on pre-incision checklist. First up are the key pre-incision steps. Time to complete, 30 seconds. The first step is automatic. As the nerve integrity monitor boots up, it will let you know if the electrode integrity check has been passed. The next will be the tap test, followed by transcutaneous stimulation. The tap test. We tap at the end of the electrode. Using this artifact, which is not a true EMG response, it does tell us that there's connectivity between the electrode needles, the wire, and the monitoring device. Going beyond the tap test is transcutaneous stimulation. Even before the incision, you can confirm the integrity of recording, of stimulation, and prove absence of neuromuscular blockade. I'm going to show you how we can now stimulate transcutaneously 5 milliamps through the skin to check the facial nerve electrodes are functioning and there's no muscle relaxing. In the next video, we'll focus on intraoperative checklist steps, as well as using stimulating dissection instruments ongoing throughout the procedure.